Hi, I'm Dr. Mukesh Gupta, Obstetrician and Gynaecologist from Lenest, Mumbai. 40 tips to 40 weeks, week 24. The tip for this week is vaccinations are essential for healthy pregnancy and their outcome. Well, we have been doing this journey of 40 tips to 40 weeks and we have reached week 24. Please watch our series if you have not already watched, and you can subscribe to our Lenest YouTube channel where you'll get much more videos regarding and relevant to the subject. So the tip today about vaccination being essential for a healthy pregnancy. What does that mean? Well, when you plan a baby, you need to get some vaccinations before you get pregnant, but there are vaccinations which are taken during the pregnancy, and then there are some vaccinations that can be taken after the delivery. Now, before the pregnancy, the preconceptional planning, you can watch our video on preconceptional planning where we've described about the vaccinations there on our YouTube channel. Preconceptional planning. Okay, now during the pregnancy, what are the vaccines? Just to make a list of the vaccines that you can take before pregnancy. One is rubella or MMR vaccination, flu vaccination, hepatitis, cervical cancer, chickenpox if you've not already taken, tetanus, etc. can be taken at that time. Now, when we talk about the pregnancy, during the course of pregnancy, the essential vaccinations which have been recommended globally, whether it is the WHO, whether it is our FOXI, Federation of Obstetrical Gynaecological Societies of India, or many other OBGY societies across the globe, the vaccinations which we talk about, one of them is tetanus vaccination. The other vaccinations which can be given along with that is diphtheria and pertussis, which can be given as a combination vaccination in one single shot. Now, the dosages for giving these vaccinations are normally 4 to 6 weeks apart. 2 dosages can be given, which will give you the immune power not only to protect you, but also the baby in the early few months of life. Next important vaccination that we are importantly giving during the course of pregnancy is a flu immunization or vaccination if you're not already immune. But even if you're immune, there is most likelihood that you may require the next shot after the break of 1 year during the course of pregnancy. So when you talk about flu vaccination, the best thing that we can do is give a vaccine of flu before you get pregnant, and then one vaccine of flu during the course of pregnancy, preferably in the 7th, 8th month of the pregnancy. So this is the ideal thing. But if you have not already taken your flu vaccine, it is better to take the flu vaccine as per the recommendations of the geographical area, depending on the season of flu and the recommendations coming from your doctor. So in simple words, the flu vaccination is best taken before the pregnancy, but if you have missed it, take it any time of your pregnancy. But definitely and surely it should be taken, if not already taken, in the 7th month of the pregnancy. Right? Now, this is for the flu protection. Besides this, there are some vaccinations which needs to be taken if you are increasingly susceptible for exposure of those viruses because of the endemic or the risk of exposure in your profession. For example, hepatitis B. If your partner is HBsAg positive and you need to take that vaccine, you need to be taking that vaccine. Irrespective of your pregnancy status, it is not a problem. There are some vaccines that needs to be taken if you're traveling in a zone which is endemic or at risk of a particular disease, and accordingly you can take that as per the guidelines issued by the local authorities or the CDC or the travel documents which are provided to you from the country where you're traveling, so that you protect yourself. Okay, last but not the least, remember, the fear of vaccination is the biggest cause for the failure of you taking the immunization. Remember, the vaccination is not just for you, but also for your family members. For example, the flu vaccination, it can be given for the whole family. We call it cocooning. So it creates a kind of a protective, protection. You can say a protection shield around the baby when all the people around the baby are protected against the flu virus. So in simple words, vaccinations are essential for a healthy pregnancy. Do not be scared or do not be worried about taking them. Talk to your doctor and they will guide you with all your queries and answers. Thank you.